Let's have a bit of a look at those teeth first, if you wouldn't mind holding on to it there for me, Jess. Let's see what's going on. Oh yeah. Oh yes. They're certainly not too bad, but a lot of the bad breath that we're getting is actually as a result of gingivitis. And even though there's not too much calculus there, we're starting to see that there is quite a lot of gingivitis associated. And there's even quite a bit of a loose tooth on one side, which may need to be extracted, but we can obviously have a bit of a look when she's under anaesthesia there. Now I'll just have a quick listen to her chest, make sure that everything's okay. Good. I can't hear any heart murmurs, and it sounds like her breathing's pretty normal. I'm pretty happy. She should be fine to go under an anaesthetic today. Now we do a little bit of blood work before she goes under, just to make sure that everything's working well, and then we can proceed with the anaesthesia as normal. Cool.
Now I know normally clients don't get to come in while bloods are being taken, but why do you need to do a blood test before dental cleaning?
We do like to make sure that there's nothing going on before we anaesthetise them. So often we do have some underlying kidney or liver disease that hasn't been diagnosed previously, and we just like to rule that out before we obviously give anaesthetic drugs which can interact with those problems. In this case, it is a very simple blood test, just to have a look at her blood cells, as well as just test her kidney, liver, and sort of glucose moderation as well. And again, just a little tiny needle to make sure that everything's okay before we proceed.
Excellent.
From here, we can take this blood to our in-house blood testing. So we have a CBC machine, which will again count those blood cells, as well as a biochemistry reader. So we put our own slides into that, and then we can get the information within about 20 to 30 minutes.
Cool.
Chica's bloods were all normal today, so we don't have to worry too much about any major diseases that are going to interfere with the anaesthesia. And we're going to go ahead with a pre-med for the anaesthetic. So basically 2 drugs, one is actually a sedation and the other one is pain relief. And the combination just helps us level out the anaesthesia and make for a safer anaesthetic. Just going to clip the leg here, just to give us access to that vein. Destroying her nice little haircut.
At least it's a pink shaver.
That's it, that's it. We have a purple one for the boys. There we go. See that vein standing up nicely there. So again, she's had pain relief and sedation on board, so she shouldn't feel too much. And we're in. Intravenous access. So from here we have our anaesthetic drug, which is alfaxin, and this is just to obviously induce a full anaesthesia, and that allows us to get control of the airways, so to pass what we call an endotracheal tube into the trachea, and make sure that we have constant oxygen supply and obviously inhalation of anaesthetic gases, and that just keeps everything nice and smooth for us. Just going to make sure that's in. There's a little bit of saline first. There you go. Perfect. All good to go. So we just give a smidge of anaesthesia. And we dose it incrementally, and that way we make sure that we're not going to overdose it. And we really aim to give minimal anaesthetic drugs for a maximal effect. So we don't sort of hit them with as much as possible, as quickly as possible. So once we're comfortable and we think that she's nice and stable there, we just need to double check that she is anaesthetised. So we have a look at the jaw tone. You can see that she's not really fighting back too much, and she's not got much muscle tone there. We also look at her blink reflex, so we actually touch that area, and if she's blinking quite a lot, then we know that she may be a little bit light, and we may need to give her a little bit more anaesthetic. Now, just going to place the endotracheal tube. Just need to go over the epiglottis into the larynx there. And then this makes sure also that we don't get fluid from the dental into her lungs, which can cause quite a nasty pneumonia, or what we call an aspiration pneumonia. because there is quite a lot of bacteria associated with the fluid that you create when you're giving them dentals. Okay, so Jess is just going to reposition her there. I'm going to plug in her intravenous fluids. What's she weigh, Jess? 3.7.
3.7.
Go down to 10 times the body weight. So just to reduce, again, that incidence of inhaling some of the fluid from the anaesthesia, we're just going to use some gauze swabs just to occlude the airway passage and make sure that any fluid that is going to fall backwards does get caught in the swab.
That's a good idea.
And we do make sure that we're monitoring everything very thoroughly. So we have our equipment here, as you can see. This particular machine helps us monitor the carbon dioxide intake as well as the amount of oxygen in the hemoglobin of the blood, and of course the blood pressure, which is very important to make sure that we are maintaining things well. You can see now a little bit more in how bad some of this calculus really is. And I know that it doesn't seem too bad, but in a human, a dentist would be telling your patients to brush more frequently if we were seeing this, especially when you start to get a lot of caked brown material at the bottom of the teeth. So I'm just going to get some gloves and a mask on, and then we'll be ready to go. So when we scale and polish the teeth, we need to make sure that we cover every aspect of the tooth. It's important when we go through that you do get under the gum line, which is again where we're going to get a lot of that infection and gingivitis. And you can see that even when I gently sort of run the ultrasonic probe under there, we're getting quite a bit of bleeding. And that is normal, but it suggests that we do have quite a bit of gingivitis. And that is usually where the bad breath is coming from in these cases.
In terms of it being a level 1, 2 or 3, whatever it is that you coach it by, what is this for?
Yeah, in her case, we use the 1 to 4 scale. So in her case, a lot of these teeth are still just a 1, where she's got a little tiny bit of gingivitis associated with some calculus, but a lot of these teeth, they are getting towards the 2. So she's certainly not the worst that we see, but we do recommend, even when they get to this point, that they have a dental, because it does prevent a lot of diseases elsewhere in the body as well. So even a little bit of gingivitis can cause dissemination of bacteria or a spread of bacteria to other parts of the body. And we do certainly see a lot of cases where we suspect kidney infection or potentially heart infection or a valvular disease that's come from dental problems. And it does sort of provide sort of support for making sure that we do have them on a good ration of foods that are going to help with the teeth at home as well. That's why we do sort of recommend bones and greenies and TD dental food, which is very, very helpful. Really, everyone's sort of saying nowadays that the risks associated with leaving dental disease in dogs is much higher than the anaesthetic risk. Now, we've been fine-tuning anaesthetics for a number of years, and we are finding now that it is a lot safer to anaesthetise dogs than it used to be. So with that in mind, I really do recommend dentals for dogs anywhere even up to 16 or 17 years of age. So I do find that that's going to be, in the long term beneficial for their health. And again, it does prevent that kidney and heart disease and even liver disease that we do see if their mouth is really infected. It's funny, you hear a lot of clients, they have cats that present with very strange symptoms or getting in worse moods than they ever were, and that because, especially in cats, dental disease can be so phenomenally painful. We find that a lot of the times, these cats are actually changing their temperaments because their teeth are so sore. So I've had a client just recently that said, I can't believe that my cat has changed so much from just doing one dental. And even by extracting those teeth, the cat's temperament improved so much. It became more cuddly and it was eating food more willingly. And this actual cat, it started to lose weight because it was so sore. And I think that, we often overlook dental disease as a potential cause of pretty serious problems. If we'd left this cat as it was, it may have even passed away from dental disease. You can see that there's quite a big gap there, and that's where the carnassial tooth or the fourth premolar would normally live. They'll usually lose that if they've been chewing something that's a bit hard for them. So she's probably had either a cooked bone or she's chewed sticks in the backyard, which aren't obviously something that dogs would normally chew in the wild, and that can definitely cause a fracture of the tooth. Once a tooth is fractured and has the pulp exposed, we can't save that tooth any longer. So now we're going to go ahead and use some Prophy Paste. So it's not good enough just to do a simple scaling of all the teeth. We do what's called a scale and polish. The reason for that is that if we just scale the teeth, we're actually leaving them open to a very fast repopulation of calculus and bacteria, because you're actually leaving a lot of grooves in the teeth. So just to sort of smooth what we've done there and to even things out, we'd like to make sure that we've got a nice surface. Now there's one tooth on the other side that I'm concerned about, which is the one that I pointed out that has the pocket down the bottom, but really there's not any teeth on the left side that I'm too concerned about, or that I would go ahead with extractions or x-rays. So I'm pretty happy to turn her over now. So this is where it is a little bit interesting. Just get you pop that on the ear, Jess. We've got two teeth that do look very different. So there's a molar here. You can see that it does look, it really looks quite disgusting. There's a lot of build-up of calculus, and there's quite a bit of gingivitis associated with it. And then in the same area, there's actually a tooth here that looks relatively healthy and not a whole lot of gingivitis or even calculus build-up. So when we compare these two teeth, you might think that the tooth with the calculus on it is quite unhealthy and it's one that needs to be extracted. But in a lot of these cases, even the calculus doesn't mean that much. And in this case, once you chip away at the calculus there, we've actually got quite a healthy tooth underneath. So by chipping away here, you can see we've actually got a fairly normal tooth with no pockets between the roots. Really no cause for concern. But on this guy over here, which is the premolar, you can see that I can actually insert the probe all the way into that frication of the two roots there. So we end up with a pretty badly affected tooth. Now, of the two teeth, this one is going to be causing pain and actually does need to be extracted at this point, because the gingival recession has gotten to the point where we can't really stop it from progressing any further. So we will be removing that tooth today. Okay, so what we're going to do now is we're just going to section this tooth. So we'll go 1 and 2, and that'll provide a nice access port to the rest of the area. By very gently rocking these teeth, ligaments start to fray. The tooth gradually becomes looser and looser. So I'm pretty comfortable that that is sufficiently loose. We can go ahead and just do a little bit of a rotation and a bit of a pull back towards me, and that should loosen what's left. And you can see there that we've actually removed the tooth in one whole piece, or the root in one whole piece, I should say. And the next step is to remove the other root. And again, make sure that we do have a complete root there to minimize infection. It is, a lot of people don't like dental work, but I think that, extractions are, it's just got to be one of the most rewarding things that you could possibly do, because once it's out, and it's reducing pain for the animal, and it's pretty much a fresh start. As long as you can get people or get owners to be quite compliant with the food that they're giving, or to make sure that they are doing dental prophylaxis, you can really turn a dog's mouth around and give them really, really fresh breath. That's one tooth down, one to go. Of course, it is very important once we do extract these teeth that we manage post-operative pain, so we'll send her home with some medications that'll keep her nice and comfortable as well. Or a monosin, please, Jess. So now that we've taken out our that bottom premolar, you see that they're nice, smooth surfaces that we've got there. Pretty confident that we've got all of the root. We won't need to do any post-operative x-rays there. And the next step is just to close the area over, and that just minimises the risk of dry socket. Unfortunately, we don't have too much information about dry socket in pets, but we do like to minimise the risk based on what we experience with humans. So to that end, we put a couple of sutures of dissolvable material in there. Now this particular material doesn't need to be removed, so it's not like you have to. We do like them to come back for a checkup about 7 days post-operatively to make sure that everything's healing up okay. But we never try and remove these sutures because otherwise you'd need another anaesthetic to get it out in a lot of cases. Especially with the dogs that aren't too happy to see us. So the trick with putting in sutures in any case is apposition, not strangulation. You do want to put them in snugly, but you don't want them to be cutting off blood supply or causing more damage than your actual surgical procedure. Good, so we've got a few sutures in there just to form a nice blood clot in the area and to make sure that we reduce any food getting stuck. And it looks really good. I think we can wake her up. So it is important we always keep an eye on them as they're recovering. Look at that, pretty as a picture. Much happier. Wider smile means happier dogs. Good, just you can probably dry her up and we're all finished.